my goal with the talk at noon was just to try and open people's eyes to what the reality is for kids in the United States in 2017, and confronting them with some of the numbers and statistics about what we know, about what poverty truly means in terms of real dollars, and thinking about how that impacts kids, not just from an injury standpoint, although it definitely impacts them, but to think a little bit even more broadly. And it was definitely designed to be provocative, to bring up things that may make people uncomfortable, and I apologize to folks if it did. But the fact of the matter remains, this is something that we have, as a society, have been willing to accept, the same way that we sort of accept 5 kids dying in car crashes every day. I'm not okay with that, and I think we need to be doing better for our kids. I think helping, at the policy level, helping advocate for policies to provide resources and services for those kids. I think making sure that kids have access to healthcare coverage is really important. And as you know, independent of political belief, this is about kids. So I think, and even for people who live in the big cities in Texas, in Austin, San Antonio, and in Houston and Dallas, there are still kids here who need us. And just to not forget that this really is about kids who have really no say over how they got where they are and where they might be, and not a lot of opportunity to work on fixing it. They need our help. I think to a large degree, I'm preaching to the choir, because we're already got a room full of people who have dedicated themselves to child passenger safety, and those are amazing people. But I think any time that we can get individuals thinking in a slightly disruptive way, not just how are you helping kids, but how are you helping the kids who need it the most? And I'm not trying to, I think anything that anybody is willing to do for kids is awesome. But we don't think about those kids who, the 22% of children in the United States, the 24% in Texas who live in poverty specifically. And they need our voice more than anything else, because they're just kids and they deserve the same opportunities as everybody else. As a practicing pediatrician, one of my observations in taking care of a lot of kids over the years as they go home from the hospital after being born, and being a car seat technician, that it felt to me like parents were really more likely to make mistakes, important mistakes with their car safety seats. And if you think about it, it's a totally stressful time. You've got, in a lot of scenarios, new parents who've not messed around with car safety seats before. They don't know how to deal with, they don't know how to take care of the baby. And we're putting it in a time crunch where there's a bunch of stuff that happens at the hospital and then they sort of go home. And I wanted to get to the bottom of that and see if what I thought I was seeing was actually what the truth was. With the idea then that we could use that information, that data, to help develop programs to support parents if it was true. So we know that in all comers rear-facing seats, 84% have significant misuses. What we found in doing a study at my hospital with families over the course of about 4 months, as they were going home from the hospital, we looked at how they actually were using their car seats, both putting the baby in the seat and putting the seat in the car. And we found out that 95% of them were making mistakes, and 91% were making serious mistakes. These are things that likely in any crash would have led to a significantly increased risk of injury for the child. And that sort of conformed to what we thought we were going to see. And we were able to use that information to collaborate with our hospital to actually develop a program for child passenger safety for newborns. And so we now have a staff technician, a CPS tech, who works on the inpatient well baby nursery, working with families. And we've been able to broaden it beyond that. She's not just doing car seat stuff, she's doing safe sleep, because unsafe sleep practices, SIDS, and sudden unexpected infant death are responsible for over 3,000 deaths a year in infants under the age of 1. And other aspects of home safety, so that we're really trying to focus on newborn safety, which is not something that's really been addressed well, other than handing parents a bunch of pieces of paper or making them watch a video before they go home in a very vulnerable time. So trying to provide hands-on practical support for families to ensure not only that the baby's getting the best thing, but the parents are getting the services they need as well. There are hospital regulations that deal with how patients can be transported within the hospital. And in a lot of places, patients are not allowed to walk out of the hospital. They have to be wheeled out by a staff person. But once they get to the curb, all bets are off. And our approach was it's not okay to do that with the most vulnerable person in the vehicle, which is this newborn baby who can't protect themselves.
So do you advocate then for each hospital to have someone who can show them hands-on?
Yeah, our approach was, in having conversations with hospitals over years, not just the hospital I'm at now, but the one I was at before, oftentimes when we bring up proposals or ideas, we get hit with, well, we can't afford to do that. It's too much money. We can't afford to provide those services to families going home. That's wasteful. It's too much. We have other things that are more important. We wanted to flip, the conversation so that it was, how can we afford not to do this? And by knowing that 91% of the families, the babies, the tiny babies who were going home from our place, were going home unsafe, convinced them that that was not okay. And it was able, and that enabled us to get them to work with us to help provide those resources.